I work with chronic health problems in children and adults, predominantly with children who have been labeled ADD, ADHD, helping to find their underlying cause of their problems. Complete physical exam, a thorough history, lab work, allergy testing, whatever it takes to determine what's really wrong. I wanted to get the information to more than just a small group of parents that I was seeing in my office. I really wanted the world to know the truth about these drugs and about these psychiatric labels on the children. And that's when I decided to write my book. Now, I'm not saying there aren't children who have some very serious problems with learning and behavior. There are. But it's not ADD, it's not ADHD, and it's not a Ritalin deficiency. ADD, ADHD stands for Attention Deficit Disorder or Attention Deficit Hyperactive Disorder. But what it really is just simply a psychiatric label. The label is based on a group of symptoms that the psychiatrists have come up with. Things like fidgets, can't sit still, can't get work finished, blurts out answers in class without being asked. I have a real problem, not only with the diagnosis, but certainly with the drugs and the effects that they can have on these children. These drugs, according to the drug manufacturers, can cause psychosis, can cause worsening and behavior problems, can cause heart attacks and other cardiac symptoms, and there have been many deaths. Not only are there side effects from being on it, but there's side effects from coming off of the drugs, and too rapid withdrawal from the amphetamine type drugs like Ritalin has been shown to potentially cause depression and suicidal tendencies also. And the parents who don't want to drug their children are told the same thing. Well, if your child had diabetes, you'd give them insulin, wouldn't you? Well, that analogy just doesn't hold weight, because diabetes is a very objectively defined medical disorder. You draw blood, you see it, you diagnose it, you treat it. And insulin, which you use, is a natural hormone in the human body that if you don't have it, you die. Ritalin and Adderall and Prozac and Strattera are not. I want parents to know that as much as they think their child may have ADHD, there really isn't an ADHD. That it is just a symptom, it's a name. Find the cause of your child's symptoms. Don't just settle for a name and a drug.